Mastering Small Pupil Phaco with B-HEX. This 60-year-old lady had previously undergone cataract surgery in her right eye, with an excellent visual outcome. However, when it came to the left eye, her surgeon anticipated a potentially difficult surgery and referred the patient to our center for further management. At presentation, the pupil was extremely small and poorly dilating. Despite repeated installation of mydriatic drops, adequate enlargement could not be achieved. A closer examination suggested the presence of posterior synechiae, where the iris had become adherent to the anterior lens capsule. Such findings are commonly associated with previous episodes of ocular inflammation, trauma, or other intraocular pathology. Interestingly, the patient could not recall any significant event that might explain the condition. Because of the anticipated surgical difficulty, we planned the procedure carefully and prepared for mechanical pupil expansion. As expected, pharmacological dilation alone was insufficient. Therefore, we decided to use a B-HEX pupil expander. The B-HEX is a flexible, disposable pupil expansion device manufactured from a medical-grade polymer material. It was designed to provide a large, stable surgical pupil through a very small incision. Its hexagonal configuration allows uniform expansion while minimizing trauma to the iris tissue. The device has become particularly popular in small pupil cataract surgery and in cases of intraoperative floppy iris syndrome. After filling the anterior chamber with viscoelastic, we carefully introduced the B-HEX into the eye. Using a microforceps, we began engaging the device with the pupillary margin. One of the engagement points proved slightly challenging. The iris was fibrotic and resistant, making proper engagement difficult during the first attempt. After repositioning the device and making a second attempt, successful engagement was achieved. Once all fixation points were secured, the pupil expanded significantly. However, we noticed another challenge. Although the pupil was now larger, it remained eccentric and slightly displaced from the visual axis. Good centration is important for safe phacoemulsification, especially when working in a limited surgical space. To improve exposure and optimize visualization, we decided to place an iris hook. The hook allowed us to gently reposition the iris and the B-HEX complex toward the center of the eye, creating a much more favorable operating environment. With satisfactory pupil enlargement and centration achieved, we proceeded with routine phacoemulsification. A well-centered capsular hexis was completed. The nucleus was then carefully emulsified using standard phaco techniques. Throughout this stage, the expanded pupil provided excellent visualization of the capsular bag and nuclear fragments. Following nucleus removal, irrigation and aspiration were performed to remove the remaining cortical material. The capsular bag was then inflated with viscoelastic in preparation for lens implantation. A Hoya Vevinex intraocular lens was implanted smoothly into the capsular bag and positioned securely. After confirming proper lens centration, we began removing the temporary pupil expansion devices. The iris hook was removed first. The B-HEX expander was then disengaged carefully from the pupillary margin and extracted from the eye. Both devices are designed for single use only and are discarded after surgery. At the conclusion of the case, the pupil maintained a satisfactory shape and the surgery was completed without complication. The post-operative recovery was excellent. On the first post-operative day, the patient's visual acuity was 6/9. 1 week later, her vision improved further to 6/6. The patient was delighted with the result, and the referring surgeon was equally pleased with the outcome. This case demonstrates how modern pupil expansion technology can transform a potentially difficult cataract surgery into a safe, controlled, and highly successful procedure. The B-HEX pupil expander provided excellent visualization, improved surgical access, and contributed significantly to the successful outcome achieved in this challenging small pupil case. Thank you for watching.